Our topic today is one of the topics of lipid metabolism. We're going to talk about ketone body metabolism. In this lecture, we are going to have some topics like the conditions that increase ketone body synthesis, the regulation of ketone body synthesis, and what occurs during diabetes and conditions of ketosis. So, to start, we have the conditions that increase ketogenesis, as we mentioned earlier, when there is extreme or prolonged fasting and starvation. Case of untreated, uncontrolled diabetes mellitus, increased fat intake or high fat diets, and conditions of restricted carbohydrate diet as during the process of weight control. First, we have conditions that increase the process of ketogenesis, as we mentioned: excessive starvation or prolonged fasting, cases of uncontrolled or untreated diabetes mellitus, increased fat in diet or high fatty diet, and case of restricted carbohydrate diet, as with cases of weight controlling. So what occurs during carbohydrate diet restriction or starvation or uncontrolled diabetes? That is as the liver starts the process of gluconeogenesis to synthesize new glucose molecules from substrates like lactate or some amino acids. This process of gluconeogenesis uses one of the citric acid cycle intermediates, which is oxaloacetate, as a precursor for gluconeogenesis. The use of oxaloacetate will lead to reduced consumption of acetyl coenzyme A in the citric acid cycle, as we deprived the citric acid cycle from one of its fuels. So the acetyl coenzyme A will be in excess, and excess acetyl coenzyme A will flood the liver and passes to the process of ketone body synthesis. And this is one of the main causes of increased ketone body synthesis. In ordinary conditions, acetyl coenzyme A inhibits the pyruvate dehydrogenase enzyme and activates the pyruvate carboxylase enzyme. This process will provide the Krebs cycle with its substrates, which are acetyl coenzyme A. But during fasting, there is overflooding of the liver with fatty acids, which yield acetyl coenzyme A upon their oxidation, and gluconeogenesis is enhanced prior to this process with exhaustion of oxaloacetate of the Krebs cycle. So there will be exhaustion of oxaloacetate of the Krebs cycle and increased production of acetyl coenzyme A, which cannot be utilized in Krebs cycle. So acetyl coenzyme A will be delivered in excess to the liver for the process of ketogenesis. So what occurs is that there is inhibition of the pyruvate dehydrogenase reaction and activation of the pyruvate carboxylase reaction. So acetyl coenzyme A is converted to oxaloacetate, which undergoes gluconeogenesis, but overflooding of the liver with active acetate from the process of increased fatty acid oxidation will lead to activation of the process of ketogenesis with synthesis of β-hydroxybutyrate, aceto-acetate, and acetone, which are the ketone bodies during produced during prolonged starvation. To understand how ketogenesis occurs and how ketosis develops when there is absence or deficiency of insulin, during absence of insulin, there is decreased uptake of glucose by tissues, especially the liver. So glucose is not taken up by the liver with decreased oxaloacetate to combine with acetyl coenzyme A to fuel the tricarboxylic acid cycle for energy production. So when there is no insulin, adipose tissue undergoes lipolysis with free fatty acid mobilization and increased fatty acid oxidation in the liver that yields excess amounts of acetyl coenzyme A with a resulting or consequent increase of ketone bodies that are delivered to the blood, generating the condition of ketosis and ketonemia. This condition is corrected when insulin is present, as insulin secretion abhors the mobilization of fatty acid from adipose tissue, with reduced utilization of fatty acids by fatty acid oxidation in the liver and consequent reduction of acetyl coenzyme A levels, and ketone body synthesis is reduced. There is also increased glucose uptake by liver and other tissues which are utilized for energy production. So insulin corrects or aborts the process of ketogenesis. So what is ketosis and ketonemia? As we mentioned earlier, that the process of ketone body synthesis starts with increased utilization of fatty acid by the liver, where they are oxidized with synthesis of ketone bodies, and this occurs in case of untreated diabetes or uncontrolled diabetes, where the levels of ketone bodies increase in blood. These ketone bodies are acidic. We have the β-hydroxybutyrate and aceto-acetate, which will reduce the blood pH, and this condition is referred to acidosis or ketosis due to the presence of ketone bodies, and may eventually lead to coma and death. When the ketone bodies concentration increases in blood, it is released in urine, a process referred to as Ketonoria, with high concentrations of acetoacetate, which is converted to acetone. Acetone is volatile and can be smelled in the breath of the patients, especially of untreated or uncontrolled diabetes or during diabetic coma. The blood levels of ketone bodies should not exceed 3 milligrams per cent in blood, but during starvation it may reach up to 30 milligrams, and in untreated diabetic cases it may reach up to 90 milligrams per cent. The urinary excreted ketone bodies during normal conditions should not exceed 120 or 125 milligrams per 24 hours urine, but during uncontrolled cases of diabetes it may reach up to 5,000 milligrams per 24 hours. So as you see here, that we have acetoacetic acid with a pH of 3.6 and beta-hydroxybutyric acid with a pH of 4.7, and these two acidic compounds increase during the process of ketosis and result in reduced blood pH. Reduction of the pH of blood results in reduced affinity of hemoglobin for oxygen with defective oxygen transport. Ketone bodies are neutralized by the blood bicarbonate buffer, which is depleted if the ketone bodies concentration is or exceeds the capacity of the bicarbonate buffer. The result will be acidosis, and acidosis is one of the major causes of hyperkalemia, which is the transfer of potassium ions from the intercellular to extracellular compartment, resulting in what is known as hyperkalemia. Hyperkalemia is one of the causes of cardiac arrest, leading to ketotic coma and death. And this is caused by as diabetic ketoacidosis is very dangerous and should be corrected rapidly. If you like this lecture, please hit the subscribe button and give your feedback in comments. And you can find other details for this lecture in the website provided.